It has been a problem the Maine's police departments, its jails, even its emergency rooms have been dealing with for years. People in mental health crisis being a threat both to themselves and to those trying to help them. Today, a renewed call for the state to do something about it. Good evening, I'm Pat Callahan.
And I'm Amanda Hill. Just yesterday, we told you how revenue forecasters expected the state to take in hundreds of millions more in the coming year. Half of it is intended to go back to taxpayers, much of the rest into the rainy day fund. But there's a growing number of people calling for more of that money to be used to expand mental health treatment. Here's News Center Maine's Don Kerrigan.
Because if you don't,
when nurses protested outside Maine Medical Center last week, they called attention to a problem that's been getting worse. Patients with mental illness languishing in hospital emergency rooms for days, even weeks, waiting for a hospital bed to get treatment, sometimes even turning violent. A problem Maine health leaders know only too well.
In the month of January, we had 125 adults and 42 children who waited more than 48 hours in one of our ERs waiting for behavioral health services.
Maine Health Government Affairs Officer Katie Fulham Harris calls it a crisis.
My son, just in 2021, spent 70 plus days in different emergency rooms here in Maine.
Christina Feeney says her 13-year-old son needs periodic hospital stays to adjust his medication for several behavioral health conditions. The last time, he had to wait more than 20 days in an ER.
He would only get worse when he's in the emergency room.
It's a problem now in the spotlight statewide and especially in Augusta, where there is a growing call to put a lot more money into fixing the state's mental and behavioral health system.
The entire system has been underfunded for a long time.
For decades, says Dale Hamilton of Community Health and Counseling in Bangor. He and others say the state has never properly funded community mental health services, and pay under MaineCare hasn't been adjusted for years. So there aren't enough workers to provide needed treatment. At Acadia Hospital, the demand for care keeps rising.
As recently as last week, when we do our measurements, we now have a wait list of 4,600 individuals needing either outpatient therapy or medication management services.
And this year?
The month of February, we saw on average 59 patients throughout the state of Maine sitting in emergency department that needed an inpatient bed.
The hospitals and service providers say Maine may need more hospital mental health beds short term, but that the real need is more money to provide proper community treatment, and they say the state has to increase MaineCare rates that pay for the people needed to provide those services. Representative Lori Gramlich is a social worker who also teaches at USM.
Some of this work is really difficult work, and you're competing with salary rates with McDonald's and with Walmart and Target, all of whom are paying at least $5 to $10 more per hour.
The advocates say the Mills administration has been making some progress. DHHS says last year it provided millions of dollars for bonuses and cost of living adjustments. And an agency spokesperson says that the current state budget, combined with the proposed supplemental budget, would bring a total of $140 million in additional dollars for mental and behavioral health. DHHS also says they are working on a study to update pay rates. But the advocates, the hospitals, and lawmakers in both parties say more is needed and needed quickly.
Not that it will necessarily immediately change things, but it will get it into a more stable footing so that the system can recover from this.
We have to do better as a state. It's a call to action for all of us.
In Augusta, Don Kerrigan, News Center, Maine.
Those budget decisions are likely still 3 to 4 weeks away. The current legislative session ends mid-April.